Hello and welcome to another episode of the Health Notebook. Today we have Mr. Tanseem Dalwai in the studio. She's an occupational therapist and we'll be exploring the topic of occupational therapy. Mr. Tanseem Dalwai, welcome to the studio.
Thank you for having me.
Can you maybe just tell us a little bit about yourself?
I'm an occupational therapist. I graduated in 2012 at the University of Cape Town, and I'm currently working at a psychiatric hospital.
Okay, so I just wanted to ask you, in terms of occupational therapy, there is the common term OT. Can you just explain to the viewers exactly what is an occupational therapist, or what is an OT?
I think that is something that many people don't always know, and very often if you tell people you are an OT, they often ask me, do you do IT? And then I'll say, no, it's occupational therapy. Okay. And then they often think it's similar to physiotherapy. So that's something that people don't always understand, and I think it's quite broad. So so just to explain that, occupational therapy is a profession in which we assist patients, we facilitate better functioning, so also assisting them to independence, basically, so helping them to be more independent within their daily lives, within the environments.
Okay, so can you just maybe give me one or two simple examples first, just to inform the viewers? So
for example, for a patient that has a disability, for example, a physical disability, looking at exactly what the patient is struggling with, and what basically assisting them to become more independent. So for example, taking into account the activities that they do on a daily basis, the engagement with work or maybe school if it's a child, looking at the environments they exist in. So for example, the home environment, the work environment, the school environment, and looking at exactly where is the barriers for that patient. So assisting them to be independent within that environment. And
you allow them to function as well independently, so to make sure that they can carry out the activity of daily living.
So it's not always about fixing the disability, but allowing them to function with that disability, or looking at exactly what is disabling for the patient. Okay. It might not be the actual diagnosis, but it might be the environment that is disabling that.
Okay, so you would adapt the person to the environment that they are in, so you'd make changes as well to the environment.
Yes, so not exactly adapting the patient, yes, but adapting more the environment and the people around that, in order for the patient to still engage in the same activities, but function better in that environment. Okay.
If you can just explore or just inform the viewers, I know there is this misnomer that physiotherapy and OT, and there is some perception in the common public that it is the same thing. As I know, there is a difference, but if you can just inform the viewers in terms of your opinion, the difference between the two.
Okay, so there's quite a bit of overlap sometimes. We do see a lot of the same patients with similar diagnosis, but our essence and the foundation of it is actually quite different. So physiotherapy looks at a lot of movement and physical therapy in order to help the patient with injury or disability function better and do things better for themselves. Whereas OT, we look a lot at taking into account the person's environment as well, but also we use activities and occupations that are actually meaningful to the client and things that they do on a daily basis. We use that in therapy to actually facilitate function. So using actual activities in therapy instead of just exercises or modality. So
can you maybe just explain to the viewers, where would we find an occupational therapist firstly, and are there different types of occupational therapists?
Yeah, well, OT, occupational therapists are all actually the same therapist, but we work in various settings. So for example, occupational therapist that works in a physical setting, for example, a hospital, with regard to rehab, they would see patients with strokes, various injuries, various physical disabilities, and look at then the occupational therapist would assist with physical rehab in order to regain that person's function. Okay. Occupational therapist that works in a psychiatric hospital, for example, would work with patients with depression, schizophrenia, bipolar, anxiety disorders, and looking at also looking at function, but looking at assisting the patient with skills and equipping them with skills so that they are better able to function within their daily lives. So the goal and the purpose of OT is still the same, but we're dealing with different symptoms.
Okay, so it's similar to medicine where you would have your different specialities like surgery, like dermatology. So in a similar essence, you get OTs for different specialities as well. Is that correct?
Yes, so they work. So
okay.
Also OT who works in the education department, for example, or in a special school, would then work with children more specifically with learning or developmental problems.
Okay. Now, in terms of you mentioned something about OTs being involved in psychiatry, and you've mentioned about skills improvement. Just elaborate a little bit. What do you actually do, and how an OT can add value in terms of psychiatry? Just some of the work that you do, so that the viewers understand where, exactly where you fit in. Yeah.
In terms of psychiatry, if you look at patients with mental health problems, psychiatric diagnosis, a lot of these symptoms are around skills. They really lack the skills to engage with people. They lack social skills, they lack coping skills, stress management and things like that. So a lot of the work we do in psychiatry is a lot of group work, and also a lot of individual work as well. But in terms of the group work, we look at equipping the patient with skills, like for example, how to manage things on a daily basis, how to manage conflict, how to manage stress, how to manage their anger. Very often they have a very low frustration tolerance, they're not able to manage conflict, they don't always understand what is socially appropriate or what is appropriate, like legally also, for example. Okay. So equipping them with the skills in order to in order for them to deal with challenges on a daily basis that they might face at home. And then also, what I was going to touch on later, a large part of the psychiatric work is also working with families. So equipping the families with skills to manage the patient. Okay. Because very often the family doesn't know how to manage the patient if they have an outburst, if they act out. So
it's a sort of multidisciplinary approach where you would not only involve the family, but you would also involve other healthcare disciplines as well. Okay, so you'd call the family in and you'd discuss with the family. Would you provide them with any training or skills, or how would you go about then engaging the family as well?
I think it's very important what you mentioned also, because like I said, the family work is very important. Yeah. So what we do specifically is we don't just look at educating the family on the symptoms or managing the patient, but we also look at involving the family in the therapy. So looking at the engagement between the family and the patient, how that is going at home, and then also educating them on how they can engage differently, having sessions with the family, teaching them also the skills on managing the patient and education, if it may be not just family, but maybe a caregiver, a neighbor, anyone that is directly involved with the patient. It's very important to equip that person also with the skills and to communicate to that person as well.
Okay, and how important is the role of the patient? I know you can provide them with skills, but I think at the end of the day it also boils down to the patient, and their motivation as well. So from your opinion as well, how critical, I know the involvement is critical in part of the process as well, and from your experience, what's your opinion about that?
I think the patient's motivation is very important, and I'm giving examples from various areas of OT now, but if I look at, for example, a patient with a physical disability, for that patient to have that motivation is important, because they need to be able to go home and practice the exercises or do the activities that was done in therapy. I mean, it's not very often you're going to have an OT every day, so that carry over to go home and do that exercises. They need to also be really involved in their own therapy as well, in order to see progress. Okay,
so just to sum up certain aspects that you've been discussing. So you've mentioned that there is the changes to the environment. Number one, you do some group work and family work as well, and you equip individuals with certain skills. What about the continuous monitoring of the patient as well, which is number one? And will you try to make all the changes immediately, or will you gradually implement certain changes within the work, within the home environment, and and even within the work environment? What's your opinion, or in terms of management-wise?
firstly very important is not to, when we do assessment, we often decide, okay, this is priority for the patient and this is priority. But I think firstly to ask the patient, what is important for you? You know, maybe the muscle strength or the walking is not important for the patient, but actually what they want is to go back to work or to just be able to take a bath every day by themselves. So to look at what is priority for the patient and what is priority for the family and what is their goals for treatment and work towards that firstly would be important. So set their goals as important, and then look at who are the other role players involved. Do they maybe need to be referred to the physiotherapist or to the doctor for assessment for medication if that hasn't already been done, and then also to work together towards that goal. And then also setting steps for the patient. If they have a goal, letting them have various steps to say, okay, so this week we're going to work on this, and maybe next week we're going to work on another step. Whereas if the patient just has a goal, they don't always know what to work towards. So if we break it down for that patient in terms of step by step, it's actually a lot more feasible for them to work towards the goal in the end. Okay.
Now I know each illness is unique, and in terms of sessions and the amount of contact time required, let's take a common illness like stroke or someone with a hand injury. How much contact sessions would you have, and in terms of follow-up and monitoring, just a rough example just to inform the viewers. Yeah.
Okay. So but sometimes it's very difficult to have regular sessions if you look at costing, if you're going through private, and also parents that need to take off work. If you're bringing a child to OT, you need to take off work every week, maybe every second week, based on how much. So we also contract with each patient is, each individual case is different. So looking at what is feasible for the family and the patient. Some patients can come to therapy every week, some patients can only come every second week. So we look at that, and then we plan therapy accordingly. And I think this also then brings in the importance of home programs and family input, because if, for example, a stroke patient has to come to therapy every week or every second week, they're not seeing the OT for 2 weeks, and then where does that leave them in terms of their progress? So also to equip the family with skills and teach them home programs, teach the patient home programs, so they can do that at home and have regular input, so as to continue progress as well.
So it's about improving their functional ability in their work environment, in their home environment. Can you maybe just give me a case example just to inform the viewers of exactly the role of OT, just a comprehensive insight to the role of the occupational therapist?
So for example, okay, take a child. An 8-year-old patient has a physical disability, and he attends a school, and he's coming to occupational therapy for assistance with his physical disability as well as some learning difficulties that he may have. So in this case then, we, firstly, assessment is very important. So looking at a thorough assessment, contacting other caregivers, aftercare, teachers that may be involved, other family members that may be looking after the child in the afternoon, contacting all the people involved is very important, doctors, other medical professionals that may be involved, and then also looking at assessment of the child. What do they like to do for fun? You know, I think that's very important. We always look at what is important for the client and what do they enjoy doing, because we always bring that into therapy. And for the child, most likely it's play. So we always look at bringing play into therapy for a child. Okay. Very important.
Just give me an example, just to inform the viewer. So how would you, yeah.
Okay. So, so if we look at the case, we're looking at, for example, the child has learning difficulties, the child has a physical disability as well. So for example, we would use play activities in the session to improve the child's function, the child's you know, muscle strength, all those different components that we want to improve in the therapy. We would use play or anything that the child enjoys. If it may be a game of soccer, if it may be a puzzle, different play things that the child enjoys, we bring that into the session and then use that to improve the different components and work on the goals that we want to work
Okay. What other aspects in terms of children would an OT get involved in? I know you've mentioned something about play now. What other areas would you get involved in?
So children with learning difficulties, children with developmental delays in children, younger children, in babies, children with autism, a lot of OT input goes into children with autism. If you look at a lot of the family work also, in terms of assisting the family in handling the child and putting things in place at home to assist the child to function better. And then also ADHD, lots of children, I think it's quite on the increase as well. Children with various developmental disorders. Learning difficulties, a lot of the children who are struggling at school often come to OTs, but often it's not always that they need OT, but sometimes they just need to be in a special needs school because it's actually a learning disorder and not just certain components that need to be worked on. And then also children with physical disabilities. So you'll find OTs working with children in various settings, like for example the severe to profound disabilities, children in special needs schools, and also in hospitals, like children's hospitals, and also in psychiatry. Children with
okay, so my understanding of OT, your scope of practice is fairly broad. You come in at various areas at various times when needed, in simple illnesses as well as complicated illnesses. Can you maybe just inform me of some of the challenges that an OT is faced with in terms of management and the discipline as a whole?
I think for me, one of the challenges is often working with families. It's also one of the joys, but also one of the challenges, because very often families are not able to get involved. If we're looking at children, for example, parents that may not be involved, and children who are living with grandparents or foster parents, it's often difficult to get families involved. And also another one of the challenges is also social circumstances. So children or adults who, very often we don't have the direct impact of therapy when there's so much other social circumstances that impacting on function. For example, domestic violence and other social issues at home, trauma that children may go through, that all impact the child's function. So directly, OT has a limited impact when there's so much other
factors around,
influencing the child. And then in this aspect also we then look at referring to social work or other disciplines to assist as well.
Okay. Mr. Tanseem Dalwai, it's been a great pleasure having you on the show, and we look forward to actually hearing from you again in the near future. Thank you very much.
Thank you.
Stay tuned for another episode, same time, same place, next week.